This is Dr. Connelly with a presentation on the use of transforaminal steroid injections for spinal stenosis, with information about what a transforaminal steroid injection is, why we do it, and some answers to common questions. A transforaminal steroid injection is a 10-minute procedure guided by X-ray. We place local anesthesia to numb the skin first, and then we use an X-ray machine to guide a needle next to a nerve root in order to outline the nerve, inject local anesthetic, and then steroid medication to treat the inflammation. This is a spinal model showing the area where the nerve exits the spinal canal and the area where we place the needle for the injection. Here's what it looks like under X-ray guidance, with the needle being guided toward the foramen. We use a very specific technique called digital subtraction, where we only see the dye so we can be sure we're not putting the medicine in a blood vessel. And this is what it looks like with the final image showing the medicine being placed around the nerve root sleeve. Transforaminal steroid injections are done to treat inflammatory nerve root pain, and we'll take a look at anatomy to help you understand why the inflammation develops and why this procedure is so helpful at specifically targeting the area where the problem is. This is a view of your spine looking at it from the side, and then if we rotate an image, we can get a better picture looking at it from a cross-sectional point of view to help understand what's going on inside the spinal canal. Let's take a look at normal spine anatomy. This is a representation of the disc, which is a fibrous band of tissue that contains the jelly inside the disc, and the backside of the bones, and then inside the space between the bone and the disc is where the nerves travel, with one exiting to the right and left on each side. Spinal stenosis is very common and results from a combination of disc bulging and thickening of ligaments and the joints that are in the backside of the spinal canal. Together, this narrows the area where the nerves travel, both out to the side and through the middle of the spinal canal. This leads to the development of pain from spinal stenosis, which includes back pain that will often spread into the legs. Typically, this is worse standing and walking, and better either leaning forward on a shopping cart or sitting down. In severe cases, weakness develops in the legs, and people have difficulty with balance. Transforaminal steroid injections are used to help people with pain from spinal stenosis when pain is not improved with some conservative treatment of physical therapy and medication, or anytime weakness is developed or pain becomes so severe that they're not able to participate in physical therapy. People often ask if steroid injections are a band-aid and that a definitive solution would be better. Well, the answer is certainly spinal stenosis can be treated well with surgical treatment. Many people prefer to avoid surgical treatment or to at least delay it as long as possible. And for spinal stenosis, steroids can be quite helpful because the inflammation may not return for a long time and the development or progression of the stenosis can be quite slow. Let's take a look at some common questions about transforaminal steroid injections. The most common question is whether the injection will hurt, and the answer is sometimes it hurts because we're putting medicine on a very painful or tender nerve, so just being near it can be painful. Oftentimes, however, people find it to be comfortable and relatively easy to have done. Are steroid injections bad for you? Well, in a single dose, the side effects of steroid injections are really quite minor. There can be some facial flushing or rosy cheeks, and if you have diabetes, the blood sugar can be elevated. You need to keep an eye on that. Long-term side effects from steroids are typically associated with long-term use of steroids, and we need to keep in mind that's typically done to treat a medical condition for which the steroids are helpful. Generally speaking, we only do one injection and then reevaluate and see how you do. If you need another injection, it can be repeated, but we don't plan to. The procedure itself only takes 10 minutes, but you'll be in the facility for about an hour to help you get ready and to help you recover afterwards. And please check with us the day before. Sometimes procedure times can change. We do the injections at Northeast Rehabilitation Hospital Satellite next to our office in Lawrence, also at Lawrence General Hospital, and at Lowell General Hospital Saints Campus in the pain clinic. The Northeast Rehabilitation Satellite facility is directly next to our office. You can see our office door there on the right and the facility to the left. It was designed specifically for pain management procedures, has everything we need, and is very comfortable. Remember to have someone else with you to drive because you cannot drive the day of the injection. If you're on blood thinning medications, we'll give you specific instructions about that. And make sure you go to the right place. One of the nursing staff will admit you and give you a personal space to sit and get comfortable, and you'll have a locker to place your valuables. Wearing loose clothes can make it easier for you. There'll be a nurse with you throughout the procedure, monitoring your blood pressure, and this includes doing a timeout. So you'll have to help us by verifying your name and date of birth and what side and what level we're doing your injection. After the procedure, we'll go over instructions. No driving for the rest of the day for your safety and public safety. Get back into your usual routine. Continue taking your medication. Keep up with your physical therapy. And in general, avoid strenuous bending, lifting, and twisting. We'll give you a follow-up appointment to check on you in 2 to 3 weeks. And that's it. We hope you're feeling better soon. We'll be happy to answer any questions you have at any time. In general, this is a safe and common procedure. Side effects can include some pain and discomfort, some numbness from the local anesthetic, some fainting episodes sometimes occur with people that are very nervous, and side effects of facial flushing that we discussed earlier. Serious consequences and risks are very rare and include spinal cord injury and stroke, or injury due to X-ray exposure. The most important individual considerations are in relationship to blood thinning medication that people take to prevent the risk of stroke, and you should talk to your doctor before the procedure and before stopping those medications. And naturally, women, we want to be sure are certain there's no possibility of pregnancy. Please ask any other questions in the office. We'd be happy to go over all of this in detail.